This is one of those handy things that you're not going to learn in dental school. How to make an immediate pink wax provisional crown matrix. Picture a patient coming into your office and they've broken a piece of a tooth and the tooth needs a crown, and you don't have a study model to fabricate a provisional polyvinyl siloxane matrix. What do? This is how you take care of that. So this is 4 thicknesses of pink wax, just base plate wax, and this is the provisional restoration we made from that. Let me show you how to do it. First, take a sheet of base plate wax. This is the tooth that's going to receive the crown. You got a crack and a decay underneath this restoration. We don't have a study model from which we can fabricate a provisional restoration matrix. So take the base plate wax, put it in your water bath. I leave a water bath going at 130 degrees in each operatory all the time with water in it, because I may need to make one of these. I may need to use green stick compound to take an occlusal registration record. You never know what you're going to need, something heated. And so I have a water bath in each operatory. You only put this in the water bath for a few seconds and it softens, then fold it in half and fold it again. Now, if you're only placing a crown on one tooth, you just want this matrix to extend to one tooth on either side. You don't want it to be a whole line of teeth because it's harder to seat it. One tooth on either side is sufficient. I'm going to cut it with a barred Parker. May put it back in the water bath after I do this. Then I'm going to roll it around my finger so that it's kind of a taco. And then I'm going to place it on the tooth. Now when you place it on the tooth, place it on both sides and then push down on the top with your finger initially. Then take your fingers and push on both sides. But initially push it down pretty firmly on the occlusal and then mold it on both sides. So you've got a tight fit on those 3 teeth. Then this is very important. Wet it with your air water syringe and cool water in that to let it set up on the teeth. If you take it out in the warm state, it's going to distort just a little bit and not going to fit back on the teeth. So this is it. What if the patient had broken, say, a lingual cusp off the tooth? What do? You do it the same way, but you're going to take an amalgam carver, the round end of an amalgam carver, and scoop out some of the wax in that broken area. So you've got space for the bisacrylate to go in and create a cusp that's like a normal cusp in that broken area. In this case, that wasn't the situation. Then you're going to drop it into just warm room temperature water in a rubber bowl. Then you're going to place it back on the tooth once you've prepared the tooth. Don't go straight to the bisacrylate in the matrix. Be sure you try it back on the tooth once it's been sitting in that bowl of water to be sure it fits precisely. Then you're going to squirt the bisacrylate into the matrix. And you're going to wet the prep tooth with water, keep it soppy wet, and then squirt the bisacrylate onto the tooth, push it to place, let it set, squirt a little bit of that on the bib so you know when it's set, and then pop it up. Here it is. You may even put it back in the water bath at this point to make it easier to get the pink wax off the provisional restoration. It'll pop right out. Mark the interproximal contacts with a pencil. Sometimes if the excess is real thin, I'll even take some scissors and cut that off before I contour it with this large acrylic burr. Be sure you don't polish your interproximal contacts away. Reduce a little bit on the occlusal surface because they're always a little bit high. It's one of those things, I don't know why, but they're always a little bit tall. So I'll reduce them just a little bit on the occlusal from the get-go. And try it back in. Now, when the patient bites down initially on the articulating paper, tell them to bite gently, because if it's a little bit tall, they'll fracture it. Tell them to bite gently, put their tongue in the roof of their mouth and bite gently. And then you can either adjust it with an occlusal adjustment, a diamond burr, or many times a shofu rubber wheel is all that you need because there's not much adjustment to be done. And that's a good way to adjust the occlusion. I'm going to put Vaseline all over the provisional so the provisional cement doesn't stick to the outside of the provisional. And then I'm going to wipe the tooth with Tublicid Red and then dry the provisional on the tooth side and then squirt this Olympia temporary cement around the edges. Don't fill it completely up, just around the edges. Put a 2x2 in the mouth, and I don't care if the tooth is completely dry. The cement's going to set up. It's going to be nice and stable. Push it to place. Then once you've pushed it to place, have your assistant put her finger on the provisional and pop floss through and pull it to the side, just so you don't have to work very hard to remove the interproximal excess cement. Then let the cement set initially with any cement. Crown and bridge cement, provisional cement, always let it set initially. And then you're going to remove it with the back end of a scaler. That way you've got the micro gap between the provisional restoration or final restoration and the tooth filled with set cement. If you wipe it in the flowable stage, you're going to pull some of that unset cement out of that micro gap. You're going to have a void. You're going to have sensitivity, stain, and possibly decay. So you want to peel it off. You don't want to wipe it off. Then pop floss through and pull it to the side. This is waxed floss. So that's the Dental Minute. These techniques work, and they work every time.
Don't you want to take your practice to the top tier? Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and so many important articles that you can only find right here. New cases are added weekly and it's only $20 a month. Subscribe today.